Good day, everyone. This is Esther May Cox. I'm serving as technology backup for this particular meeting, helped design some of the layouts. The meeting is being recorded. It is May 7, 2014, and we will begin with comments from the course facilitator, Shana Rouse. Go ahead, Shana.
Hello all. Welcome to the second Community Engagement webinar. My name is Shana Rouse, and I will be facilitating this webinar. If you have any questions during the webinar or need any technical assistance, please type your questions in the chat box. Please be considerate of our speakers and mute your phones during the presentation. Today we have a webinar by Lillie Hall on visioning. Lillie Hall is the Community Systems Director with the Department of Health and Environmental Control, Upstate Public Health Region. He has more than 15 years public health experience. She is currently working to impact overall community health through promotion of healthy eating and active living strategies. Ms. Hall specializes in community engagement, partnership development, and policy and systems change. All of her efforts foster collaborative and sustainable public health systems that identify and address community health needs. Please help me in welcoming Lillie Hall.
Good morning, everyone. I hope everyone's doing well. Thank you so much for inviting me to be a part of the course. Before we begin, I would like to gauge whether I'm really preaching to the choir or not, and would like for you to participate in an opening poll.
We have one person that's participated as a facilitator, 7 people have participated as a participant, and 5 have not participated in the visioning process.
Okay.
If you previously have participated in a visioning process, what was the environment or type of setting? Oh, please type your answers into the chat box. We currently have Margot says she's participated with the community setting. Janice has participated with Eat Smart, Move More, Richland County. We have a variety of other people typing right now, Lillie, just so you know. Denise has participated in a community setting in York County. Laura has participated in a community setting in Anderson County. Charles has done strategic planning in a community setting, business setting, and cross-sector collaborations. Regina has done a community setting in Williamsburg County. And that seems to be all of the answers right now, Lillie.
Wonderful, wonderful. Thank you so much. It sounds like we have a variety of experiences on board, and that's great because we can learn from each other. It sounds like more of you have participated in the community process, the broader community, as the most common setting that you've participated in, and that's really, really great. Before we go into the actual presentation, I am going to get this together for you. I'm hoping that everyone is able to see.
Lillie, this is Esther May. We actually have a little glitch at this point in time. Can you find your way back to the meeting room and reload yourself so that we can see your desktop? Looks like it's coming now.
Wonderful.
Okay, now we do see your screen, so yes. If there's someone who does not see the words vision, phase 2 visioning on the screen, would you either send a note in chat or open your phone mic and indicate that so that we make sure everyone is seeing Lillie's screen at this point. This is a major part of her presentation. I'm watching for things to be shown up in the chat. So I believe we have everybody, Lillie. Go ahead.
All right, wonderful, wonderful. Thank you so much. So, at this point, most of you, if you were unable to participate in the previous webinar, some of you may still be familiar with the MAP process. And so, at this stage, at this point in time, you've organized for success. That was your phase 1 that you completed. So, let's continue along the roadmap. The second phase of the MAP process is visioning, and that's what I'm going to talk to you today about. So, what is visioning? It's a process for a group that has activities that lead to a shared vision and common values. It's important because it fosters communication. This is very important to the process, the MAP process, because it sets the stage for the rest of the process. So is it a hard process? I don't believe so, and I'm hoping that some of you are feeling the same. We must envision to dream. We must envision and we must dream. We must also know the difference between a vision, a mission, and values. Visioning provides a focus, a purpose, and it drives our direction for the full planning process. It gives the community something to strive for. One of the things we do know is that visions can easily be confused with missions and or strategic plans. An easy example of a vision is our DHEC vision. And for those who are my DHEC colleagues, you know this quite well. Healthy people living in healthy communities. So what is a vision? It's a direction. It's a glimpse of an ideal future. Again, it's a dream. We can look at it like it's a blueprint to provide focus and purpose of how we want to build and structure our group. On that note, let's chat once more. What brainstorming questions would you ask to get a shared vision for a healthy community? And at this time, I'll ask Ms. to help us with that. If you can answer the questions in the chat that is before you, all of you should be seeing that at the moment.
We have a couple people typing, Lillie. So. Denise has said, what would you like the end result to be of your project? Laura has said, what is your definition of an ideal community? Charles said, what does success look like for us? We have other people typing. What does a healthy community mean to you? Angela has posted that question. What difference will we make together? That's a question that Charles has posted. That seems to be the majority of the questions right now, Lillie. Okay,
wonderful. Well, thank you, everyone, for those responses. Those are actually great ones, and we will definitely hold on to those and capture those because, as I mentioned earlier, I think that we can learn from each other, and hopefully those who are participating on the webinar today will be able to utilize some of those statements. They are great lead-in questions that can be used, and as most of you may know, posing a question is the most commonly used strategy when you're doing a visioning process. But there are some things you can do that are a little more interactive. One of my favorite is this particular one, where you would have each person to write a headline of a newspaper story about the organization 20 years in the future that tells about the success of the organization has had. They can then share stories and develop a list of common vision themes. This is generally sometimes used for the basis of writing the vision statement, but you can also use it early on in the visioning process for that question to engage the community, to really get them thinking about what they want to vision. And then in the end, you'll be able to use some of these notes that you've taken from activities that are interactive, like what I just mentioned, to do a little bit more with writing the statement. Of course, that comes later. Okay. A mission is why an organization or entity exists. And again, for my DHEC colleagues, our mission is we promote and protect the health of the public and the environment. Missions are generally clear, memorable, and concise, and they average generally less than 20 words. When you start to get more than 15 or 20 words in a mission, that's when it becomes too cumbersome and too much for anyone, including the group members, to be able to follow and stay engaged. So your focus is to keep the mission less than 20 words. So what is a mission? It's what we do to get to the vision. It's those actions and strategies planned. It's also the people we serve. Basically, the mission answers what, who, and how. Before we go to values, let's talk a little bit about a couple of missions before we talk about values, because mission is not really a part or a large part of the visioning process. That, of course, comes later when you start to form and organize an official group. But let's talk about a couple of mission statements just so you can hear what I mean about the what, the who, and the how is what defines a mission. Let's look at the Starbucks mission. Their mission is to inspire and nurture the human spirit, one person, one cup, and one neighborhood at a time. If you think about that mission, it says that they provide quality coffee, for those of you who know Starbucks, provide cheerful customer service. They're always happy when you go in, and they always try to make your visit as best it can be. And they contribute generously to the community because they're out there. They provide lots of grants, lots of community support. They just do a lot in the community. So when you read back at their mission to inspire and nurture the human spirit, one person, one cup, and one neighborhood at a time, you can see that that mission surely fits. Let's look at a second one quickly, the Google's mission. And a lot of you, everyone, has to know about Google. They started in 1995 with a small little search engine that was supposed to capture keywords. And their mission is to organize the world's info and make it universally accessible and useful. Now, I would have to say that they have achieved their mission, and I think they continue to achieve their mission. Okay, so let's move a little bit back to our points for the day. As I mentioned earlier, the missions come later once a group is more established. So let's talk about values. Values are basically the group's dynamics, how a group works together or how they collaborate. You can also look at it as a litmus test for how a group should behave and treat each other. These dynamics is what determine how far and how successful and how you sustain the group that you're working with. What generally causes a group to break down? It's because they may not have established values. They may have not established this litmus test so that each time a conflict arises, they're able to control it. Again, the values help to establish rules of behavior for the group. So we know that the vision and the values are important. Let's chat again about the values. What are some examples of community values you feel should be addressed?
Laura has said inclusion of everyone in the community. Charles has mentioned inclusion as well, and he also mentioned compassion. Laura also mentioned respect for differences and opinions. Catherine mentioned a healthy environment as a community value. Denise mentioned community values should benefit all parties involved. There should be an opportunity for all to be able to collaborate. There should be compassion, integrity, and excellence. LaVonda mentioned various community activities geared towards the population. And that seems to be all of our community values from the participants, Lillie.
Wonderful. Thank you all so much. What you mentioned are right on in regards to values and the things that you should be talking about at this stage of the visioning process. You should be looking at those things that you mentioned: inclusion, compassion, respect, looking at the dynamics of a healthy environment, what it should look like, some of the things that you want to include, how it should benefit all those in the party, making sure you offer a variety of activities so you, again, can be inclusive, looking at integrity. So all of those things are definitely values that you want to look at when you're working with a community process. You also look at things like, for example, with DHEC, we have cultural competence, we have customer service. Again, it talks about mutual respect. We have commitment and teamwork. All of those things are addressed in some of the things that you mentioned. So thank you so much for taking time to respond to that chat. As you talk about all these things, you realize that this is and should be common sense sometimes. And, you know, we probably can chuckle when we say that, but more often than not, common sense is not present. You have to establish an understanding, and that's where the values are important. So when would a group need to go through a visioning process? And there are a couple of reasons that I want to mention when a group should go through a visioning process. The first one is when there is new alignment. And by that I mean a couple of things, a few things. Developing resource partnerships. This can be an example of the great partnership that we have with USC and the training center. Developing new community or civic groups. A lot of you, this is probably the area where you have worked most or participated in most. And then, of course, when we want to do community needs assessments. And a great example would be the need in 2012 when hospitals were required through the Form 990, Schedule H, to complete community needs assessments. This is something that the hospitals traditionally did not or have not been doing in the past. They've always been responsible for their community benefit reports, but not necessarily responsible to do assessments to make sure that they are covering all of the needs of a community. And if they're not covering the needs of a community through their community benefit, then they should also know who they should be partnering with to make sure. So it was part of their new requirement in 2012. So that's one reason that you would want to participate or conduct a visioning process. A second reason would be if there was an organization or a group that wanted a new direction. Sometimes that means organizational change, where it may have been a new owner, it may have been new ideas. What about policy changes? When a policy changes in any entity, there has to be actions around that policy change to make sure it's enforced correctly. So sometimes that's included as a new direction. And then a final one, and this is not comprehensive, there are others, but when there is a group that wants a refreshed mission, and as I mentioned earlier, that mission comes when the group has been established. But when they refresh their mission and decide that they've exhausted what they've been working on, or if the community dynamics or if the environment changes or whatever changes may occur and they feel like they need to change their mission, and then this is, too, another time that they may want to refresh the group and do a visioning process. Let's talk a little bit about who should participate and their role. As with any group and with any phase of the MAP process, it's important to understand that each group will have their own structure, and these are just some of the common guidelines that I'm going to present to you today. Let's chat about the types of committees or the types of groups within the visioning process that you would want to be inclusive. You would want a core group or a steering committee. Sometimes those are one and the same. It just depends on the organization, the agency, or group and what they're working to achieve. You definitely want to have community participation, and we'll talk a little bit more about that in just a moment. And then there could potentially be subcommittees, but in a visioning process, that's not necessarily recommended, because you will do more of those subcommittees when you get to the larger group, when the group is more established, and you start to have those activities that you're working toward your mission. Let's talk a little bit about the core group or the steering committee, which you could have one or both. Just depends on that group. Who makes up the core group and the steering committee? Generally, when you're looking at new alignments, it could be the directors, the community reps, the civic groups. It could be representatives of the civic group participating with the directors in a new alignment. But when you're talking about a new direction, you want to definitely make sure that you have community advocates, you have those community agency reps, those interested and concerned citizens, as well as the CEO and leadership if required. Getting to that community participation, which I mentioned earlier, is so important. Community participation is essential for true community collaboration. There is really no way that you're going to be able to say that you have the community input without making sure that you have those that will be impacted by your mission, by your vision, and your values that you're bringing forth as a group. The core group and the steering committee must also plan and promote for community participation in a variety of ways, and someone mentioned that earlier as one of the values, that they must do all kinds of strategies to be able to pull in the community, whether it's through things like what I have noted on the screen, focus groups, key informant interviews, town hall meetings, and reports. And you may say that sounds a lot more like the next phase that you will participate in. I hope that you all will come back and participate in the next webinar when that presenter will be talking more about phase 3. But you also look at some of these things, some of these strategies when you're doing your visioning process. You just do them at a smaller scale because you also want to know prior to developing your vision and your values what are some of those strategies going to be in your mission. And the only way to get there is to work toward the community participation part. And that includes some of these strategies noted. Something we'll talk a little bit more about closer to the end as well is keeping the community informed and updated as well as the vision in front of the group as they progress. This is very important and it's a huge part of community participation. It's not necessarily having someone actively engaged. It's actually having someone be more informed, and if you keep them informed, then they are engaged. Okay, so what are the steps to success? You have some great tools in the community engagement toolkit. And the group, Ms. Shana Rouse and others, are working really, really hard to finalize that toolkit for us. But you have a worksheet in that toolkit that's a great resource to guide you through the steps of the visioning process. But what we'll do today is just briefly go over them, and then I will share some examples with you, some case examples, just to talk through some of it. And hopefully that'll be of help to you as you decide on your visioning process. The first step, identify other visioning efforts. The reason you want to do that is because you want to make connections. You want to build a history. You even want to create links with the MAP process so that you can expedite it. If there have been some visioning efforts or similar efforts that have been done, you can incorporate them in what you're doing to save time and expedite the process. Then you want to design the process. And again, I encourage you not to reinvent the wheel. You have a great tool or a great tip sheet in the toolkit that you can use that guides you step by step to designing that process. And it includes things like the invitations, who you need to invite to make sure you have great representation. It also talks a little bit about how to promote it and what avenues or venues you want to use to promote it. And then, of course, it talks about some steps and gives you a lot of tips on how to actually conduct the visioning process. So be sure to utilize that tip sheet. You have that worksheet which serves as a checklist for you, but then that tip sheet actually shows you how to design the process. And if you follow that, it will be very easy to keep step by step and to make sure you're including everything that you really need to do. Then you want to finalize the statements. As I mentioned earlier, if you did an active engagement like either the questions or either asking someone to write something like a newspaper article that they would like, what they would like the community to look like in 20 years, if you did those kind of things, when you get to this point of finalizing the statement, you don't really want it to be a large group that's doing this to wordsmith it. At that time, you do want the smaller group, so it may wind up being the core group or the steering committee to actually work on wordsmithing the statement. But what you want to do is make sure that everyone at some point gets a chance to review and approve it. So that means that at this point, after you finalize it and after you've done even some small visual brainstorming sessions and other activities to help formalize what that final statement is going to look like, you may want to do a town hall meeting to present it. You may want to go group to group to present it. Whatever that may be, you definitely want to make sure you have some input from the broader community once that final version is devised. And then what I mentioned earlier about community participation and keeping them actively engaged or keeping them engaged through information is to share often. So once you devise that statement, you want to keep it in front of them. Every meeting, you want to be able to have information on there about the vision statement to refer the group back. What this does is to keep them embedded in the process. Some of those things that you want to do to keep them embedded in the process can be things like make sure every group meeting ends with the vision and the question of saying, as a result of our work, have we lived out the vision and values of our group? When you have annual meetings with that group, you want to bring it forth to them again. You want to make sure all of the leaders at every one of the meetings, the core group or the planning group, or once you develop a little more, you want to make sure that the leaders have a deep sense of the vision and values. You want to make sure that as newcomers come on board, that they have a deep sense of the vision and values. And you want to continue to highlight them in a variety of ways, even if that means things as small as putting up posters, those kinds of things in the meeting. So keeping that vision statement in front of the group is the key to success for the rest of the MAP process. So that's why the visioning process is so important. As I mentioned earlier, let's look at a few case examples. I want to talk to you a little bit about what I call using fine china. Just about two systems that I was able to work with, Greenville Health System and Bon Secours St. Francis with their china, as well as a abbreviated MAP process with Novant Health Gaffney Medical Center. And then I'll just briefly hit on a large community process. As most of you might be familiar with the community group Live Well Greenville here in Greenville County. The first one, as I mentioned, is the local public health, a local public health system example between the two hospitals. And I will reference a few things in just a moment, but for now I'm just going to go through them, and I'll go back and reference those points in just a moment and share some things with you as well. With the two hospitals, I was approached by the community relations members at each one of the hospitals at different times, and I saw an opportunity to do a process one time since it was the same community. So I proposed the MAP process to these two hospital organizations. And in doing so, we did exactly what I mentioned earlier about scanning the community for prior visioning processes or anything that may have occurred to bring a group to this point. And long story short, and which, like I said, I'll highlight some of these things, what we did was we completed a visioning process backwards, if I may. And what I mean by that is we sort of pulled the group together because in working with the hospitals, each hospital came with their own vision and they came with their values. And what we needed to do is to align their vision and values with the MAP process and bring the two groups together on some common values. And we were successfully able to do that. We were able to develop a timeline as well. And when you look at what we were able to do and you wanted to align the process with the MAP process, we organized for success when we defined the community and identified certain organizations that were going to participate. And then, as I mentioned earlier, sometimes you will gather input and data during the visioning process to make sure you know what group you're going to be working with so you can establish a good vision statement. And in doing so, we completed the visioning process at that time. Another one was with Novant Health Gaffney Medical Center, and they're considered to be, and if you're looking at the visioning process of doing it with either with a local public health system or with a public health system or the broader community, working with Novant Health Gaffney was working with the healthcare system directly. We were approached by them to help them finalize their their community health needs assessment, because they came into this already having, again, their vision and their values, but what they wanted to make sure is that they had a vision in the right direction. And so we pretty much worked with them to pull together a group of people that looked at visioning, they looked at some of the things that they wanted to do to align it with what services and programs they were already doing. So that was an abbreviated visioning process with them, and hopefully in phase 3 with the next speaker on the next webinar, she will talk a little bit more about the Gaffney Medical Center project. And you'll see some of those things we went through, but I will show you a little snippet of what we participated in just a minute. The final case example is with Live Well Greenville. A lot of you are familiar with Live Well Greenville.
I'm not.
Excuse me? Okay. Thought I heard someone respond to me. A lot of you may be familiar with the Live Well Greenville. If not, I encourage you to visit Live Well Greenville at their website, livewellgreenville, all one word, .org. But that is a broader community effort that started back in 2007. First meeting was in October of 2007, where a childhood obesity task force was developed or conducted by the Piedmont Healthcare Foundation. At that time, Piedmont Healthcare Foundation was looking to address the issue of childhood obesity, and so they wanted to pull together a group to learn how they might be able to support the efforts of a group that would be wishing to collaborate in the community around that issue. And in doing that, that particular group was another one that came in with lots of representation from many different groups. We had the YMCA, we had the local family health center, the FQHC. We had both hospitals, of course, the foundation, Piedmont Healthcare Foundation. Of course, myself was there with DHEC. We had the higher ed institutions of Furman University. We had the Recreation District, and many, many others participated in this. That discussion we had at that first meeting was actually the visioning phase that we participated in. And I'll show that to you in just a moment with some highlights, and you'll be able to access these materials for your viewing at your leisure. During that discussion, we actually was able to come to common values as well. And the foundation posed those kind of questions to the group to make sure that the visioning process was complete. That group, of course, morphed between 2007 and 2010 from the Childhood Obesity Task Force to the Healthy Kids, Healthy Greenville, where obesity research was done through Furman University, to what it is now called today Live Well Greenville. And that group has well over 100 key partners. I will share with you also an item that you can look at for that as well. Now, before we go into the final chat, I wanted to highlight some of those items to you. So I'm going to go back here. Okay. This first one that you're viewing is the Greenville County. It's a list of participants that were in the focus groups. And as you see, for those who are familiar with the MAP process, those are the actual essential services focus groups that were conducted around the 10 essential services. But what I wanted you to see in this particular example is just the makeup of the participation. And you see how it was very inclusive. There were a lot of people who participated. Most of these were the board members of each one of the hospitals, but they also reached out to community advocates, to community agencies to make sure that we had a inclusive list of people participating. The next item that I wanted to, that was with the two hospitals, Greenville Health System and Bon Secours St. Francis. The other one I wanted to share with you is this particular one, which was, this is a list also of the participants for the Novant Health Gaffney group. And again, it shows you the makeup, and all of these people on this particular group listing participated in that visioning process. Now, in that prior one I just showed you with the hospitals, with GHS and St. Francis, all of those people were not participating on the actual core planning team, but they were representatives from both hospitals and from both boards of each hospital. With this particular one, all of these ones you see listed on here participated in the visioning process. The next one I wanted to mention to you, this is actual minutes from that first meeting that we held for the childhood obesity group at that time. And just for those who may be interested, the reason why it morphed and changed names is because the group saw childhood obesity as a one focus, and sometimes a negative connotation could have been pulled from that. And so instead of just working with children, they decided to make it a broader community effort, and that's why it morphed to what it is now called Live Well Greenville now, and it focuses on several. And I'll show you a sheet in just a moment to show you which groups were now in it. But I put this up here so that you would see, you'll be able to see the makeup of those ones that I mentioned who participated in the visioning process. But I'm going to jump quickly to this third page here talking about the discussion. This is what I mentioned to you earlier. Katie Smith still is the executive director of Piedmont Healthcare Foundation, who led this effort. And what she did was pose several questions. Some of the ones you all mentioned earlier as part of those potential brainstorming questions. And we did a few activities as well. And these were some of the points captured from some of those activities and the questions that were posed. And when you get a chance to go back and see it, it'll be, I'm sure Ms. Rouse will have this accessible for you later. But what you can see when you go through this is some of those points, particularly further to the bottom, you actually see a point that talks about consider the other communities who have already done this. You see that particular point, that last bullet? All of these things highlight what I mentioned to you earlier about coming together on common values. So we were able to use this as a visioning process. The final thing that I want to show you is the actual Live Well. It's one of the sheets that we used in, there we go. It's one of the sheets we used in a newsletter in 2011 because we have yet to pull another one of these together to make it so succinct. But this just gives you a nice little snapshot of the leadership team, which actually most of these people were the ones who served on those original core group planning meetings that we did along with a few physicians. We were very fortunate to have some MDs and some other physicians practitioners working with us on this group early on, and they became part of one of the focus group, one of the focus areas, one of the work groups. You see that down at the bottom right, right here in this little area, you can see that there are several work groups. The one that's not showing there right now is the At Worship work group that has been added since 2011. So you see it's over 100 key partners that are actually participating in Live Well Greenville. But we were able to conduct a visioning process. We were able to keep the community engaged. One of the things we do at all of the meetings is we do keep the vision, mission, and values before the group. Every meeting starts with our mission and vision and ends with the mission and vision. And if there's any conflict that arises, we do have steps and protocols in place to really work with those. But that's why this group has been able to sustain as long as it has. With that being said, at this moment, I would like to move to a few chat questions. And I will let Ms. Shana lead.
If you could start typing your responses to what caught your attention about the presentation. in the chat box, that would be great. We have a couple people typing, Lily. Catherine mentioned she really likes seeing the process of initial idea, adapting that to meet the community needs, and becoming something better in the end.
Wonderful.
LaVonda mentioned reinforcing the mission and vision to people who are a part of the organization. There are so many times we get lost in everyday work assignments and forget the purpose. Lily, are you able to see the screen with the chat box?
I am. I am able to see it.
Okay.
Yes. Ms. Angela just made a great comment, showed the example of working with the organizations that already had a vision and mission, but how you can still work to align new goals. That's exactly right. And that's why when you're looking at visioning, you definitely want to think about whether it's a new alignment or if it's just a new direction. And so it really guides your process and determines where you need to go. And Denise, the one thing that stood out to me the most was the clarification of the difference between a vision and mission, because I think a lot of times we do get that confused, also realizing that there has to be a good representation of all members of the community. We oftentimes don't think out of the box. You're so right, Denise, and that's why I wanted to make sure that that information was in there. We often use mission and vision interchangeably when we shouldn't. We just have to remember that the vision is, of course, that dream that we see, and then the mission is those things that we're going to do to get to that dream. Thank you so much, Laura, and thank you to Catherine and LaVonda. I did not speak to those, but thank you, Laura. The reminder to use the toolkit already developed is great. I also enjoyed your examples of your experience with groups, especially Live Well. I plan to use the reminder to keep the vision in front of the group frequently, and that is very important, Laura, very important. Okay. I think we can move to the next question. Okay, if you all would answer that question, what barriers would you expect to run into when conducting a community visioning process? Thank you, Laura. Voices, and I think you meant opinions, drowning out others. That is so true. If you don't establish values very early on and make sure that that issue is covered, that very well most likely be one of your barriers that you will encounter. And once you're in the process, it's harder to make changes there. It's harder to try to establish a value after that fact, because sometimes it just kind of propels the conflict. Thank you, Charles. Unwillingness to question the status quo. That's exactly right. And again, when you're developing your values and talking about what the group is going to be about, this should also be a topic that comes up for discussion. Same thing with you, Angela, people having different ideas on the vision and not seeing the same. That's the whole purpose, because your goal is to focus in on consensus as close as possible, as best you can, because that's going to drive the rest of the process. If you don't make consensus at the visioning process, at the visioning phase, it's going to be harder when you start to look at assessments. You're going to start to engage in turfism. We all are familiar with the turf wars. So this is something that you want to address during the visioning phase. These are all great and important topics that you must address during visioning. Shekinah, bringing together the right people who need to be a part of a process. Very similar to what was just noted. Ms. Nesmith, some community members having their own agenda and not coming together. Again, exactly what Angela and Shekinah was talking about. And then Denise, getting others to want to participate. I love the smiley face, because this is one of the hardest things. Because if you don't, at the very beginning, that core group and that committee, that focus or steering committee, that's an important role of them to make sure they're bringing people to the table with the right carrot, if I may, for lack of better words at the moment, that they are bringing them in with the understanding that we're going to talk. This is what we want to see, if we can collaborate, if we can come together. So while you're working that process, pulling the right people to the table, you're also thinking and working through what it is that you need to say and do to pull people in. And again, you're not selling the idea after you've decided on an agenda that you want. It's the group talking about it together. Sometimes it's hard to get people to these meetings. That is definitely one of those barriers. And again, it's going to be that innovative and creative ways that that core group works on. Angela, people may be resistant to change. That's very the same thing, actually verbatim what Charles was talking about. And then Catherine, you agree to people not wanting. I agree about the people not wanting to change the same. Wonderful. Thank you all. And we can go to the next question. What did you learn today that you could implement in the future? And I appreciate all of your participation. This is great. All of these notes will be taken account of, and hopefully we'll be able to have some of those available for you as well. So thank you for your participation. Okay, Marjorie, you learned how to find a toolkit and not reinvent the wheel. Yes, very important. Sonia, the value in keeping the vision at the forefront. Yes, ma'am, very important. And, you know, at the forefront and all the way through the process, not just the visioning, but the whole phase and continuing on when you're working with the group. I think someone mentioned it earlier, how we tend to drop that off and forget to do that, and then we wonder why the group is falling apart. Well, it's because we've lost vision. Shekinah, keeping in front as well. Marjorie, reinforcing the mission to everyone. And it seems like there's a common theme here about making sure that we keep the vision and values and keep everyone involved in the process. And it's okay for a core group to come out of the bigger one. Sometimes the work has to be divided up. Also using the toolkit as a guide, and agree with the others about the vision. And I see a couple more. Learning the difference between the vision and the mission. Keeping the vision in the forefront again, another common theme. Thank you all. And we'll just take a couple of more in the interest of time. Okay. Definitely the theme again about keeping the vision in front. And Ms. Catherine, in a brand new community with community engagement and now visioning, this will keep things focused when you're in the groups discussing on new goals and ideas. Wonderful, wonderful. Well, thank you all. I'm going to make sure I turn this back to Ms. Shana.
Okay, thank you, Lillie, for your presentation. Do any of the participants have any questions for Lillie regarding the vision process, or do you have any questions for me regarding the community engagement course? If so, please type those questions in the chat pod below. Questions or comments? Denise has asked, will the slides be available to download? Yes, I can make those slides available. And I will put them. Denise, are you in the course? I can put those. Yes, I will put those slides in the course shell, and I can do that and send a reminder email to everyone that they have been posted. Angela mentioned a very good presentation, Lillie. Okay. Now we have the wrap-up questions. So if you could type your answers into the chat pods for what went well today, suggestions for improved virtual meetings, or any other comments, you can put those in the 3 chat boxes. And I want to take this time to thank Lillie Hall for joining us today. I appreciate you taking the time to share your experiences. Thank you to all the participants for joining today. If you have any questions concerning the community engagement course, please. Please don't hesitate to contact me, Shana Rouse. The next webinar will be held on May 14th. This is a Wednesday from 1 to 2 p.m.
And I'll just chime in and say thank you, everyone, as well. I enjoyed it.
And thank you all for providing your feedback today. Greatly appreciate it. Thank you, Esther May and Nylene, for your help with the behind-the-scenes action. It would not have gone this well without you. And thank you again, Lillie.
You're welcome. Thank you.